Healthcare delivery. What are some major issues that our healthcare is facing today? Technology. In this day and age, any career field relies on technology, but especially the medical field. We're seeing a lot more transitioned into electronic paperwork and electronic billing and all that, rather than paper and stuff being sent in the mail and all that. There's also a lot of companies are gearing towards doing like a medical app. Like I know my personal clinic that I go to has a medical app that they allow you to go on there and message your provider or ask questions and even do like an e-visit, which is definitely really nice. But along with that does come some negative things too. You know, if the system crashes, if people are having technical issues, all of that can also be a negative effect on that as well. The good versus the bad. There's some bullets. I'll just go through and read a few of them here. The good is it allows patients to communicate with their providers and medical staff without having to come into the clinic. It allows the patients to have access to their medical information easily, which I know is definitely a nice thing for people for vaccinations. They can go ahead and print those on there without having to go to the doctor to get a vaccination list to bring their child to daycare or enroll them in school. Patients can schedule appointments. They can do e-visits, like I said, and allows the providers just basically to stay better connected with their patients. Bad, it takes away from the personal interaction that is to be had with the provider and patients, which is very important to providers, I feel. E-visits are now... Alright, so then along with the face-to-face, the e-visits always are an accurate interpretation of what's going on. There could be more to be seen that the doctor isn't seeing because they're doing an e-visit. And it essentially it allows patients to think that they don't ever need to come into the clinic. Me personally, I worked at a clinic in the past where people would do e-visits and they would just assume that the doctor would always prescribe them the medication without having an actual appointment visit, which to me is not a good thing. Issues with managed care. Many people are stating that managed care has a negative effect in the healthcare industry and that it's actually harming its patients rather than helping them, which is what the program was put in place for. It was put in place to help patients. The arguments are stating that managed care is not allowing patients to get all the treatment that is available, and they're also saying that providers are not giving them all the options available. Essentially, they're saying that providers kind of have some type of contract where they can only give certain type of treatments or medications, or essentially they're not giving their patients the full spectrum of treatments for whatever illness they may have. Defiance in the bureaucratic management. Pros and cons of bureaucratic management. Pro would be work is constantly being completed and on time, staff staying on track with work and responsibilities, decision making is faster, more control over all staff and situations, more financially reasonable for a company. Some issues with it would be upset staff, feeling as if they're being micromanaged, which that's definitely something that creates a very unhappy work environment is micromanagement. It discourages creativity for the staff. It's hard to adapt to changing situations, and jobs can be more repetitive, leaving staff to have a lower morale. So if you're running to work doing the same thing every day, you're not going to be excited to go to work. The healthcare reform and how does it affect us as management? The new healthcare reform does not quite have an effect on management. I would say not so much directly, but very much so indirectly. It allows the staff to have more room for error with insurance, as well as making the process more complicated and complex. While it allows people to have access to healthcare, there are more restrictions and outlines, which with any kind of insurance, that type of stuff. It's definitely difficult, but with the new reform, there is, like it says in here, a lot more restrictions and outlines that need to be watched closely. What are ways that we can help improve healthcare and reduce costs? Small steps, make sure not to overstaff, which will reduce costs for the company. On the slower days, don't schedule as many staff. On busier days, schedule accordingly. Possibly have on-call staff is definitely a good way to prevent that overstaffing. Reduce costs by ordering only materials and items that are needed. Research for alternative costs or alternative places that would be more cost effective. Always reduce ways that can result in major losses for the companies. If the floor is wet, put a wet floor sign and whatnot. Just simple ways to prevent lawsuits and major losses like that could happen with the company. And then reduce any testing that is not needed. Now on to the next PowerPoint here, which is the communication. So just a few things with communication here. Motivation. Every person is motivated in their own unique ways. Some people are just self-motivated and others easily able to motivate others, while others lack self-motivation and need some extra oomph to get their motivation going. The extrinsic motivation, behavior driven by external rewards. This motivation originates from outside a person, so basically they need some type of incentive in order to be motivated, whether it be bonuses, rewards, promotions, that type of stuff. Intrinsic motivation is originated from inside a person, so from within them they motivate themselves rather than having to work for or work harder because they're getting rewarded with something. Here's just a few examples of what motivates them. Now that you know the two different motivators, what would you say that you fall under? Personally, I think that I fall under a little bit of both. I like to motivate myself, and there's many things that I do that motivate myself, but it's always nice to have a promotion or a bonus or a more pay, something to look forward to. Interpersonal communication is the process of exchanging information and messages through a verbal and nonverbal communication. So here's the layout between the two. Basically, verbal is, sounds and words, things that you can hear that express yourself, whereas nonverbal communication is your body language. Are you making eye contact? Are you, slouching? Those types of things, like shaking your head that you understand what they're saying. The two and two definitely go hand in hand. Interpersonal communication in the medical world. I personally believe that interpersonal communication is a very important type of communication within the medical world. It involves two main types of communication. Verbal is important because you're using words all day, every day, whether it be to your providers communicating medical information to their patients, or a manager discussing deals with medical reps, or even the staff. Along with nonverbal communications, just as important because, one, you need to look professional at all times, which to me is very important when I'm going to the doctors. And then two, eye contact is so beyond important, especially with dealing with serious medical issues. All right, now on to the human resource aspect here. Human resource is a company department in charge with finding, screening, recruiting, and training job applicants, as well as administering employee benefit programs. They're also responsible for handling employee terminations, unemployment issues, and sometimes handle payroll duties. We'll update job descriptions as well as post open positions on a company website as well as hiring websites, and oftentimes wears many hats just simply in one day. Some issues that they deal with is wrongful termination. which, like I said here, is pretty self-explanatory, basically being terminated, whether you shouldn't have been, or even, the wrong steps being taken towards termination. When terminating an employee, it's very important to make sure you have all documentation, the proper steps being taken, just because, a unemployment suit against a company can cost them a lot of money. Organization is huge within any position, but especially in management. As you can see, here's a pros and cons list. There's many more pros than this, but really essentially the only con to being organized is it can slightly be more time consuming, but you essentially make up for that with it being organized in the future. Recruiting is probably one of the major roles of the HR department. You're the face of the company. You're the one who's looking for new applicants. You're putting yourself out there, meeting with schools, new graduates, posting job positions, and interviewing staff. Essentially, you are the one that's representing the company to these new employees. So if you are representing yourself not very well, it's going to honestly turn them away from working for that company. Hiring, there are so many steps that go into the hiring process here, and essentially it can be altered to each individual new employee as well. But as you can see here, steps 1 through 9 are what we would like to stay within lieu of. Mentoring can be defined as somebody who provides guidance to a less experienced employee to help guide them in the proper direction when within the workplace. Usually it's an employee that had been with the company a little bit longer and has a little bit more experience. It's a good program to have in place because it allows staff to have someone to go to with questions or situational advice if a manager is not available. If you're working for a provider and you're a nurse and you're the 2 nurses for that provider and one's a little bit more experienced, it's a little bit easier to say, hey, I have a question on this. What is your opinion on it, rather than having to go to a manager for every situation. It benefits both staff members as well as the company. A needs assessment, it looks at where the company is and where we would like to be. Essentially, this helps us set our goals for the future. Commitment. Commitment can be defined as a state or quality of being dedicated to something, giving something your all, and essentially not giving up. This is major in the healthcare world because providers are here to help their patients, and not only providers, but everyone in the medical field is there to help patients and help people better themselves, their lives, and just a better being, essentially. So whenever you go into a doctor's office, you want to see the same provider. You want to see the same front desk. You want to see the same nurse, the same person that's drawing your blood. It's just, that's all part of being committed to your patients as well as the company. Upward feedback, essentially this is feedback for someone who's above you. It can be a little intimidating sometimes to give feedback on a manager, but it is always good to hear the good and the bad. As long as you're putting it in the right way, they're not going to get mad. All right, and then lastly, we're on to marketing. Healthcare marketing, what's it all about? It involves creating, communicating, and delivering health information and interventions using customer-centered and science-based strategies to protect and promote the health of diverse populations. What makes it different than traditional marketing? With healthcare marketing, you are targeting the health population and the population that is concerned about their health. This may not be everyone. The goal is not to target the people who are interested and concerned with their health, but also get those who are not on board as well. So people who, do care about the vaccinations or do care about, having their yearly physical or preventative care. It's about advertising and marketing to them too, but as well as getting other people who may not think it's a big deal, getting them on board as well. What is market segmentation? Basically, break it up. Segmentation is when you break something up into a group. Market segmentation is just that, grouping people into sections that would suit them so you can properly market to them. Groups, just some examples, they could be anyone, people with babies or kids, teenagers, elderly, sports players, people who have been diagnosed with a chronic illness, people of a certain ethnic group, single people, families,